Welcome, everybody. Thank you for coming to our class, the ABCs and 1, 2, 3s of baby care. We're going to be having our class in sessions of 3. So each session will focus on different aspects of parenting that we think would be helpful for you. So our first session is called Making Sense of the First Year. And what we're going to do, Michelle's going to give you a little rundown about that.
We're going to cover regular and very normal baby development for the first year, and your role regarding doctor's appointments and other obligations that you have in order to care for your child.
Including some apps that might be interested to you that are either free or very low cost, so you can have the reminders constantly for you.
We also will cover some warning signs that you can look out for your child in order to prepare for your doctor's appointments, to talk with your doctor about the development of your child.
And we know it's pretty scary when you're a new parent. Having had some of us go through it, we understand. And things to look for so that you're not afraid of what's, to distinguish what's normal and what you should contact your doctor about is something we're going to talk about.
Absolutely. And also, I think we're going to cover using what supports we're going to use in order to get to the doctor's appointments and other obligations that you have to do for your child in the first year of development.
Okay, so that's session 1. Rima's going to tell you about session 2.
Okay, so basically what session 2 is just going to cover is diapering and feeding, the basics of that, knowing if your baby's eating enough, and also kind of giving you helpful ways and techniques of how to keep up with that, with like a chart with diapering and feeding. Also using breast milk versus formula, the benefits of that. We'd also go over like breastfeeding positions and knowing, what positions that make you feel comfortable when you're breastfeeding your baby, and just learning how to hold and support your baby in a comfortable position before you get, really comfortable with that. And also getting some experience with that, and as well as, positions for burping the baby and when it's appropriate and when it's not, following, diapering and techniques for diapering hygiene as well.
Great. So our session 3 is going to be what we're going to focus on in depth today, and that's going to be talked about by Sade and Turquoise, who will be here shortly.
Good afternoon, ladies. All right, so this is the power section. This is a section that's going to help you understand your baby. And we're going to kick it off with Ms. Turquoise.
Okay, in today's session, we will be learning about different stages of understanding your infant as a baby, because these are very important for the parent and also for the caregiver to understand the different stages of the infant while they're developing. And in those stages, there's a sleep and an awake state. And I'm just going to touch on 2 briefly. And one of the first ones is an active sleep. And in this state, you will notice that there are some body movements from the infant. There are some rapid eye movements, fluttering of the eyes underneath the eyelids as they are closed. And then also during this state, the child makes a smile and makes a brief fuss noise. And then also the infant is able to respond to internal stimuli. And then also in the next state, which is a awake state, is a crying. And in this state, the baby cries. This is maybe letting the caregiver know maybe some of the needs are maybe not being met by the baby. Maybe the baby needs to be changed, needs to be fed. Also, maybe the baby is maybe not feeling well. So this state really lets the caregiver know that something may not be right.
All right, we're going to flip on over to my stage. And my stage helps us to get to know your child. We're going to basically be looking at what cues the child will give you to let you know whether or not they're hungry, whether or not they're sleepy, if they're gassy, if they need a diaper change. For instance, my son, he only cried whenever he had a number 2 in his diapers. So we just want to help you to understand the important things and cues that your child gives you to help you take care of them better. Another topic that we are discussing today will be how to soothe your child, how to comfort your child. They involve about 3 different topics. One being kangaroo care, which is what we're going to demonstrate today in class. It basically encompasses skin-to-skin contact with your child, developing them mentally, aiding and developing them socially. We also will talk about how to properly swaddle. That actually imitates what it's like to be in the womb, which is why children love it, or infants, newborns per se. And we'll also go over infant massage, and this is very essential with colic babies. I actually used it with my son when he was little. He had issues with colic, so we set the mood, put a little nature music on, and massage him so that we can get that gas on out. We'll go ahead and switch back over to Miss Turquoise.
And also, we want to touch on, as teen parents, that they have a lot of frustration. And so, one of the things that a parent can do if they're feeling frustrated, is maybe just take a time out. Also, try to call a caregiver to maybe help them with the baby, so they can maybe just be able to pull back. Because also, we know in this developmental stage with teen parents that there's a lot of shaken baby syndrome. So to avoid shaken baby syndrome, we would suggest that the teen mother would find someone that is more suitable to be able to care for their child at that time.
All right, guys. We thank you for joining us today. We'll go ahead and bring up all the teachers today so that you can know that we are on your side to give you the 1, 2, 3s and the ABCs to child care.
And just one more thing, that we are the occupational therapist students who are teaching you about the importance of engaging in different occupations, both ADLs for feeding and dressing your baby, and education about the importance and the safety of parenting your baby in a way that will provide development. So we thank you.
All right. Bye, guys.